Winter is here, and while cozy blankets, hot cocoa, and festive vibes make the season magical, it also brings hidden health risks that many of us don't think about. From respiratory infections and heart strain to mental health challenges like seasonal depression, winter can test our bodies in surprising ways. Hi, I am Dr. Geeta, and welcome back to Dr. Geeta's Lifestyle Hub. In today's video, we'll explore the health concerns winter brings, who's most at risk, and the preventive measures you can take to stay strong, safe, and energized all season long. But before we move on, please tell me in the comments below, which city or country are you watching this video from? I love knowing how far our wellness family has spread. Let's start with the most common winter health issues: respiratory illnesses. Cold air and pollution can trigger asthmatic bronchitis, while viruses like RSV thrive in colder, drier air. People with COPD, asthma, or lung fibrosis often find their symptoms worsening during this season. Even healthy individuals may develop persistent post-infectious coughs that linger for weeks. And of course, pneumonia and sinusitis cases rise dramatically in outpatient departments during winter. So if you're coughing more than usual, it's not just the chill, your lungs are working harder than you realize. Now, who's most at risk? Infants and children under 5 have developing immune systems, making them more vulnerable. On the other end of the age spectrum, adults over 60 face compromised immunity, higher risks of pneumonia, and even heart attacks or strokes. Patients with chronic conditions like diabetes, cancer, tuberculosis, AIDS, interstitial lung disease, or rheumatoid arthritis are also more susceptible. Think of your grandparents or young kids. Their bodies need extra protection during winter. Winter doesn't just affect the lungs, it also impacts the heart. Cold weather causes vasoconstriction, meaning blood vessels tighten and blood pressure rises. Sudden exertion, like shoveling snow or heavy outdoor activity, can place intense strain on the heart. Respiratory infections add another layer of risk by increasing inflammation, which can destabilize arterial plaques and trigger heart attacks or strokes. So pacing yourself and avoiding sudden bursts of activity in the cold is crucial. Beyond the lungs and heart, winter brings other challenges. Reduced sunlight can lead to seasonal affective disorder, or SAD, a type of seasonal depression. Skin issues like dryness, eczema, and cracked skin are common due to low humidity. Obesity worsens lung function, making infections harder to overcome. And people on immunosuppressive drugs or the elderly often experience slower recovery from infections. Winter really is a season where multiple vulnerabilities converge. The effects of winter illnesses don't always end when the season does. Severe infections like viral pneumonia or influenza can cause prolonged cough, fatigue, and post-infectious bronchial hyperreactivity that lasts for weeks or months. For those with pre-existing respiratory conditions, these infections may accelerate lung function decline. That lingering cough after the flu? It's more than just annoying. It can be a sign of deeper impacts on your health. So how can we protect ourselves? Prevention is key. Start with diet. Include colorful fruits and vegetables rich in vitamins A and C, quality proteins like beans, lentils, chicken, fish, and eggs, and healthy fats from nuts and seeds. Fermented foods like yogurt, kefir, kimchi, and sauerkraut add probiotics that strengthen immunity. Avoid high sugar foods, refined carbs, fried or oily foods, and excessive alcohol. Hydration is essential to keep airways moist and defenses strong. Sunlight exposure is equally important. Vitamin D plays a vital role in immune function. Even short walks outdoors can help. For respiratory protection, breathe through your nose when outside and use a scarf to warm and humidify the air you inhale. Asthma patients should always keep a rescue inhaler handy. And don't forget vaccinations. Annual flu shots, especially for those over 50, can dramatically reduce infection risks. Finally, for skincare, use emollient moisturizers to combat dryness and eczema. Winter doesn't have to mean sickness. With the right diet, sunlight, vaccinations, and lifestyle choices, you can enjoy the season while keeping your health in check. If you found this video helpful, don't forget to like, share, and subscribe to Dr. Geeta's Lifestyle Hub for more science-backed lifestyle tips. Stay warm, stay healthy, and I'll see you in the next video.